Good day, everyone, and welcome back to our training on Advanced Basic Life Support for Prime Care Nursing Practice. In this session, we will continue our discussion on AED and Post-Resuscitation Care. But before we proceed, let's quickly review our previous lesson. In our previous lesson, we described what an AED does and when defibrillation is indicated. We also identified AED parts and demonstrate safe AED operation steps. Now back to our topic. By the end of this module, participants will be able to demonstrate correct pad placement for adults and children, apply safety precautions and special situation adaptations during AED use. Now let's get started. How are AED pads placed correctly for adults and children? Correct pad placement matters because the electrical shock must travel through the heart effectively. The pads must be placed so the electrical path crosses the heart safely and effectively. Adult pad placement. For adults, pads are placed on the upper right chest and on the lower left side of the chest. This is often called anterolateral placement. Child pad placement. For children under 8 years, use pediatric pads if available. Place one pad on the front center of the chest and place the other on the mid-back. This helps avoid pad overlap on a smaller chest. If pediatric pads are not available, adult pads may be used as long as they do not overlap. Note: pads should never overlap. Next, what safety precautions must be followed during AED use? AED safety is very important because electricity is involved. The most important rule is that no one should touch the patient during analysis or shock delivery. AED safety protects both the patient and the rescue. Other safety precautions include: move the patient to a dry area if the surface is wet. Wipe the chest dry before pad placement. Shave excess hair if pads do not stick properly. Place pads at least 1 inch away from a visible pacemaker or ICD. Keep oxygen sources away from the direct shock area. Avoid direct contact with metal surfaces touching the patient if possible. Note: always say "clear" before shock delivery and visually confirm that nobody is touching the patient. Now, let's look at how AED is use-adapted in special situations. Some situations that need small adjustments during AED use include wet environment. Move the patient to a dry surface if possible and dry the chest before attaching pads. Hairy chest. If the chest is very hairy and the pads do not stick properly, remove hair quickly or use one pad to strip hair away before applying a new one. Pacemaker or ICD. If there is a small device bulge under the skin, usually below the clavicle, place the pad at least 1 inch away from it. Pregnancy. Pregnancy does not stop AED use. Treat the patient as an adult and continue high-quality CPR and defibrillation as indicated. Metal surface. Avoid direct, unsafe metal contact and make sure rescuers are clear before shock delivery. Children under 8 years. Use pediatric pads if available. If not, use adult pads with antero-posterior placement without overlap. Note: special situations require adjustment, not delay. In summary, do correct AED pad placement helps the electrical shock pass safely and effectively through the heart in both adults and children. Also, during AED use, nobody should touch the patient during analysis or shock delivery, and rescuers must always say "clear" before a shock is given. Special situations such as wet surfaces, hairy chests, pacemakers, pregnancy, metal surfaces, and children may require small adjustments to ensure safe and effective AED use. That is it for this session. Thanks for watching. See you in our next session.